All right, so the question came up, what kind of things are there that you can talk about, Dr. Marble, with regards to pediatric foot and ankle conditions? First of all, when I first came out into practice, people thought all the time when I told them that I was a podiatrist that I worked with kids. You know, pediatrician, podiatrist, two different things. There are actually, though, pediatric podiatrists. And so there are podiatrists that actually just work with kids. But over the years and having kids of my own, there have been a couple of things that I'd like to highlight that I really think would be valuable for this forum. And the first one is during the first few months of life, parents are very, very concerned as to, is my child normal? Of course, when they're born, we count all fingers, all toes, make sure everything's in the right place, all the bones are there. And really, though, there is some things that you need to be aware of that are naturally occurring. And there is always, with every infant, an unfolding stage. And that is during the first 1 to 2 years, because they've been folded in uterine, that means that it takes some time for them to unfold. And that means, femurs and tibias and feet. If they are folded really tight in that womb, though, there can be a condition called clubfoot that would be very important for you to address early on. And so that's where the foot is in. It's also it's also pointing down, and it's turned in like this. And so that unfolding takes a little bit of help, but it can be done very easily when you come to a podiatrist that's skilled in something called the Ponseti Method. Ponseti is a famous orthopedist who developed a method of casting that helped to encourage and help the unfolding of those feet, so that when it was time to start walking, that the patient would be ready and to start going forward without having to go to do aggressive surgery to get their foot into the right place. And so if you have any concern about the appearance of your son or daughter's foot, and if there may be a potential for clubfoot, please bring them in to Pueblo Ankle and Foot Care or to your nearest podiatrist. The next thing that I see quite a bit of as well is, and this is something that I'm a culprit in doing, is as your child is growing, and boy, they grow quickly. And so what we find is that there can be ingrown toenails that develop, there can be nail abnormalities that occur just because we're not making sure there's a half size to a size larger than what you measure when the patient stands, when your son or daughter stands in their shoes. Also, interestingly, those closed-toed, what's the pajamas, the onesies, that you stick their feet in. Sometimes they get their feet and they just grow, and eventually, and at some point, your son or daughter just has grown out of it. But if we try to make those things last longer than they should, cut the toes out of those footies, and those onesie pajamas. Make sure that they're not getting crammed into any clothing items. Because your son or daughter might really love this clothing item or this pair of shoes, but you gotta just retire it, maybe bronze it, put it on their mantelpiece. Don't stick it on their feet anymore. So that's some ideas for you. This is 2 topics within the first 1 to 2 years of life, and maybe down the road we'll do some more. But if you have any questions or thoughts, please contribute those in the comment section, and please subscribe.